I'm going to tell you about the principles that we CED trustees have agreed on as the principles that should guide healthcare reform, and I'm going to tell you how we got to these principles. But first, I have to tell you we didn't expect to have to be here today. 6 years ago, CED issued a report calling on employers to implement many of the principles that I'm going to tell you about today and to guide and lead the structural reforms of healthcare. A lot has happened over the last 6 years about healthcare. You've seen the way the numbers have evolved. 2 years ago, we took stock of the situation in our research advisory board and found that healthcare was still going in the wrong direction. For the people under 65, the fraction of employees who were covered by employment-based health care had dropped from 68% to 63%. That's a decline of almost 1 percentage point a year between year 2000 and today. And the number of uninsured people had increased from 39 million to 47 million. That's an increase of almost 1 million people a year. The current system is simply failing. That conclusion is inescapable now. What are the alternatives to fix it? Lurking in the background of all this is a presidential campaign, and those of you who read the New York Times yesterday probably saw the New York Times editorial board's summary of the health care proposals of Obama and McCain. That summary would be summarized in the following way. Basically, the Obama proposal is for near universal coverage, and there is virtually nothing in the public proposals that would deal with cost control or cost containment. And the McCain proposal has some things in it that might lead to some more cost control, but very little attention paid to coverage. Neither proposal is complete. Neither proposal is adequate. Now you will believe that CED is nonpartisan. There is, however, one immediately available fix that could be done with the stroke of a pen. And lurking behind all this is that proposal. That proposal is Medicare for everybody. With a simple stroke of a pen, we could extend Medicare to cover everybody. Medicare, of course, does not have any cost control, but then we would do what most of the European countries do, and that is we'd couple it with a global budget on Medicare. We'd fix the total amount of spending. The government would fix the total amount of spending in some way, and then basically force that total down into all the pieces of the medical system. Healthcare prices would be fixed. We probably would end up making all doctors government employees, civil servants. Virtually all innovation would be stopped. And in the end, we would have to ration care. We would ration care by waiting in line. And it's ironic, just when some parties in this country urge us to go in this direction, the parties who are already doing this are desperately trying to find a better way to manage health care, as virtually every European government is at this time. That may be what we end up having to do if we procrastinate long enough and don't fix the problem, and there be no other way left for us to do other than this. But it is a woefully poor second choice to what we could do. Why is it so hard to do the right thing in healthcare? Well, just a little primer. To start with, healthcare is bloody complicated. Some of us need a lot of healthcare and others don't need much. So we have to have an insurance function. We think we may know when we're sick, but sometimes we're sick and we don't know it. And so we need a very highly trained professional class of people who can tell us when we're sick, who know what it is when we are sick, and they know how to treat it. These are doctors. We can't do that for ourselves. So basically we have an insurance industry that decides on the scope of health care and how we buy it. And we have doctors who decide on the content of health care and the standards that have to be met there. This has turned out to be a very stable arrangement. Unfortunately, it leaves us out. We, the parties who benefit from the provision of health care. It also leaves out the people who pay for health care. The employers, by and large, although if you subscribe to the economically correct view that that really comes out of total compensation, in the end we also pay for it. So we are left out of both deciding the value of what we get, and also we're left out of influencing it through our payments for it. What's lacking here is basic fundamental economic principles, the principles that have made our economy so successful everywhere else. The doctors don't know these principles, and it's unreasonable to expect them to implement them. The insurance companies probably know these principles, but they're a little reluctant to adopt them because those principles actually would cause them to have to work a little harder.